12 months of social distancing, and somehow we're more connected than ever. Here's to all of us for walking this road together. 702. Let's walk the talk.
You're with John Perlman.
As you've probably heard during the week, as a station with all the presenters, we've been looking at various elements and aspects of 1 year of the coronavirus pandemic in South Africa. Over the next hour, we're going to focus very much on the health issues. We're going to talk to one of South Africa's first patients. We're going to talk to the team that treated one of Gauteng's first patients. That's coming up a little bit later. We'll be taking an international look. The United States has really been hammered by COVID-19. We'll engage with Dr. John Blandford from the US Centers for Disease Control on the line to us from Atlanta. And we'll spend time with Sandile Cele, a South African biochemist who came up with a creative way of growing the South African COVID-19 variant, the variant most prevalent in South Africa. Let me be absolutely clear, 501Y.V2. That's its correct name. So that's what we're going to be doing over the next hour. We'd love to hear from you about your experiences. Do communicate with us on WhatsApp. Send us a voice note on 072 702 1702.
702.
Coming up at 5:10.
The newsmaker of the day.
Our newsmaker of the day is a little later going to be Boang Jones, Gauteng Provincial Manager of the South African Human Rights Commission. They have had a look at the City of Joburg's upgrading of informal settlements program. They've come up with some alarming things in their report, including the fact that on this key issue, only 11% of the budget has been spent. We're going to be looking very, very closely at that at 5:10.
Drive home with John Perlman
On 702. Let's walk the talk.
So let's go back now, back in time to a year to when Minister of Health, Dr. Zweli Mkhize, faced the nation on television and said this.
We confirmed the existence of a patient who has tested positive for the COVID-19 virus for the first time in the country, and this patient was identified in the province of KwaZULU-NATAL.
I certainly remember my own feelings when I heard that. We'll talk about yours and certainly share those with us as the next hour unfolds. But let's welcome our first guest. Megan Smith joins us on the line. She was one of the first 50 confirmed coronavirus cases in South Africa. Megan, welcome and thanks so much for giving us your time on 702 Afternoon Drive.
Thanks, John. It's an absolute pleasure, and I thank you for having me.
There's so much we still don't know about COVID-19, but at the point at which you became infected and ill, much, much, much less was known. What did it feel like? Because you knew something, the doctors knew something, but this was a very open-ended journey that you were about to embark on, I would imagine.
Yes, it definitely was. And, we caught the virus before lockdown even hit. We were one of the first 50 in the country. There was no protocol back then. So we had doctors phoning us every single day, checking up on us and kind of figuring out day to day what to do with us and, how to go about testing and when we would be considered, better and able to go out into society. That was all very just, day by day figuring it out.
And presumably going online would have been something of a mixed blessing because there would have been some information, but there would have also been a sense of this thing taking a grip on the world with terrible consequences. How did you go about informing yourself? Did you set any parameters on how much time you spent on Google?
No, I don't think we really spent much time on Google figuring it out. We were very lucky in the sense that we had direct access to many of the doctors at, the Western Cape Health Services.
Right.
And they were giving us the best and most up-to-date information on a daily basis. But, in terms of panicking and needing to know exactly what was going on, we didn't get extremely sick. My dad, who was 70 at the time, and he was actually going through chemo, he did get quite sick. And yes. So, we had to speak to doctors and consider the possibility of going to hospital. Thank goodness we didn't actually get there. But we didn't have a sense of panic from a health perspective. It was more just from the unknown and not really knowing what the right protocol was and how to deal with it effectively. That was more where the panic was coming from.
And how's your dad now?
He's absolutely fine. He, he obviously had to put a pause on his chemo and fully recover from COVID, which wasn't a fun journey. And then as soon as he recovered from COVID, he had to finish up his chemo and, feel terrible all over again. But it's been 6 months or maybe even longer now that he's been clear of everything, and he's running up the mountain again, and he's fit and healthy and happy. Well,
long may it remain that way. Was there a moment when you knew, Megan, okay, we've been infected, as you say, you weren't terribly ill. Was there a part of you that thought, okay, this is kind of over? Was there a point at which you realized this is a long, long road, whether it's directly for you and your physical health or more for you as part of a community that has many, many more kilometers to walk on this road?
I think in terms of our physical health, each of us, there were 5 of us in our family who all got infected from my sister-in-law, Julia, who, she will confess that her hangovers felt worse than COVID. She was over it within a day. To my dad's, it went on a bit longer. And I definitely had a fatigue that just lingered for a really long time. And it took a long time to kick. Even when we tested, after we would have tested negative, I still had that fatigue. And I was like, when is this going to end? But then from a, larger perspective and more of an economic perspective, I definitely had a gut feeling in the beginning that this wasn't going to be a short road. That this was, in the beginning, I think we all thought, we're going to be in lockdown for 3 weeks, and after 3 weeks we'll be let free and everything will be fine. And I just had a gut feel that that wasn't the case. And, as time's gone by, we've seen that this is still going on a year later. We're still essentially in lockdown.
Well, thank you very much for your time. May your good health and the health of your family continue. And let's hope these become receding memories rather than new realities. But I think we've got a tough and difficult journey still ahead of us. Megan Smith, thanks for your time on 702 Afternoon Drive.
John, have a great day.
Over the next hour, or the rest of this hour until 5 o'clock to be more precise, we're looking at the 1 year, marking 1 year of COVID-19 in our lives as South Africans, and talking about the many things that people have had to deal with and do. Of course, individuals have been required to do incredible things, but teams of people have had to work together and do some remarkable things as well. We're now going to spend some time with a team of people from the Charlotte Maxeke Hospital, and I'm going to introduce you to 3 of them. First of all, we say good afternoon to Dr. Erica Shaddock, who is one of the treating doctors dealing with the first COVID-19 patient in Gauteng. Dr. Shaddock, welcome to you and thanks for your time on 702.
Thank you, John, and thank you for this opportunity.
Joining us as well, professional nurse Sister NTHABISENG MUDZHIDZHIDZHI was also part of the team dealing with that first patient. Sister, welcome to you and thanks for your time on 702.
Thank you for having me.
And of course, behind every team of health workers is a team of other people who are involved in keeping spaces sanitized, not contaminated and cleaned. Aletta Tusi was part of that team, a health worker cleaner working at the Charlotte Maxeke Hospital. Ms. Tusi, Aletta, it's great to have you with us. Thanks for joining us this afternoon.
Thank you. Hello.
Yes, hi, Aletta Tusi. Thanks for giving us your time.
Okay, thank you.
Great. Dr. Shaddock, let's start with you. You would have known this was coming, but I would have thought that dealing with the first COVID-19 patient to be admitted to a Gauteng hospital must have been daunting in many different ways. What was the hardest thing?
So I was part of the team that looked after our first patient, and there were a couple of other doctors who were more in direct contact with her. But obviously everybody was quite concerned at that point, and it was about finding a place in the hospital that allowed for isolation for that particular patient with very little throughfare of other people, who potentially could be exposed. at that point in the pandemic, we were transporting patients from one side of the hospital to the other through the tunnel at the hospital, which is down on the second floor under the parking lot, to try and avoid exposure to anybody else. That has obviously changed now, but back then it was very, almost top secret the way patients were transported around, and this particular patient as well. Everything was, we definitely had anything different now, but back then everybody was very, very nervous and full PPE and patient isolated and spoken to only from the door. It was very, very hard.
In terms of your experience as a doctor, you would not have dealt with this before, although some of the symptoms, respiratory distress and so on, you would have training that would have prepared you for this. Did you feel that to some degree, though, you were dealing with an unknown? Because even now, a year later, there are things that happen with COVID patients that are not predicted and certainly not necessarily certain in their outcomes. What was it like a year ago?
There were a large amount of unknowns a year ago, and even now we're still seeing new things with the COVID patients that keep cropping up. But we were luckier than most because obviously we weren't part of the original first patients that they saw in Europe and China. So we did have those patients and the experiences that those doctors had already gone through to look back. We obviously contacted our colleagues in the Western Cape for advice. But yes, it was incredibly daunting and something we'd never seen before. There was a lot of fear, especially with regards to the transmission of the virus to ourselves and our other colleagues.
Sister MUDZHIDZHIDZHI, I mean, you as a nurse, a long career, you faced many, many challenges. What was especially difficult about dealing with COVID-19 when it came to Gauteng right in the beginning, to the heart of Charlotte Maxeke? What was your biggest challenge as you remember it?
The biggest challenge was that it was something new to all of us. So we felt like we're dealing with something that we don't have knowledge in, something we were never taught at school to say. And then we felt like we were not prepared for it. So at first we were just seeing it in the news that it was happening far, like in other countries, but not really expecting it to be this close to us. So when the patient first came in, it was a very terrifying moment for us. But we had to actually deal with it in hand.
How did you deal with it? Because there are diseases that are incredibly dangerous for the patients. I think this is one of the most risky for the people required to treat them. I mean, for example, what was your family saying when you said, COVID's come to the hospital and I'm on the front line?
I remember when I got home and then I told my partner that today we actually received the first patient in our unit. And it was one of the first people that went in, the first team that attended to the patient. He was so scared to a point that he was like, okay, we can't both be exposed to such. I'm just going to move home for a short while until everything dies down. But I think he saw how frustrated that made me, that added to my frustration. So he was like, in the morning, he was like, no, I'm not going to move back home. I'm going to stay and support you. Yeah. And my mom was the worst. She should call almost 5 times a day just to check on me, like, you're not feeling any symptoms. How are you coping? But, well, we pulled through.
You pulled through and are still having to pull through. I mean, it really is a long road, and the road still stretches out in front of us. Aletta Tusi, as someone responsible for keeping the ward where this was going on clean, what do you remember of that time? How difficult was it for you in the job that you do? Aletta, are you...
Hello?
Yes, hello. I don't know if you heard my question.
Okay. So come again, excuse me. I was trying to find the network.
Okay.
Hello?
Yes, hi, we can hear you nice and clearly. Did you hear my question?
No, come again.
Yes, I was just saying, what do you remember about that first COVID-19 patient, with you having to play the important role of keeping the place safe and disinfected?
I remember I was so scared, nervous,
Yes.
I didn't know to start, and put all that PPE stuff on me. Yeah.
And what did you... Sorry, do continue.
It was difficult for me.
And what did your family say, Aletta, when you spoke to them about this change that had come to the hospital and that you're still busy with? What was your family's thoughts when you came home that day?
Yeah, my family was so scared, and guess what? They wanted me to resign.
Yeah.
They were so very, very scared. But as time goes on, they do consult me and ask me the questions. They told me how I must be strong and pray.
Yes.
Yeah, but it was difficult for them because they didn't know how does that patient look like.
Yeah.
They were so disturbed that I'm gonna infect them. I'm gonna be infected and also infect them.
An incredibly difficult time. Just a last thought from you, Dr. Shaddock. I mean, a year down the line, many patients later, many shifts, waves coming and waves going, and it looks like another one coming. Are you used to this now, or is there a part of you that for which this will always be difficult and have you on edge?
I think for most of us, we have gotten used to the setup with dealing with these highly infectious patients, and at times we have to keep reminding ourselves that it is the same virus we were dealing with a year ago. We do still have to be in PPE and maintain that appropriate distance, because you do get a little bit blasé at times.
Yes.
Just because there have been so many of these patients, and obviously things have changed so much over the last year. So yes, it's not getting any easier. And every time we are told that the third wave is around the corner, a lot of us feel, can we cope with it all again?
Right.
Because when we are those peaks of the waves, it's soul destroying at work. Not just the numbers coming in, but the patients dying with, not always necessarily good treatment that we have available for them. So as much as it has got easier, it is still a very, very tough road that we are all walking on.
Well, can I say to all three of you, to Dr. Erica Shaddock, to Sister NTHABISENG MUDZHIDZHIDZHI, and to Aletta Tusi, part of a team, and there are probably thousands of them around South Africa, dealing with COVID-19 patients at every single level. First of all, can we just say our thanks? Can we wish you well for the difficult days that lie ahead, and we'll keep you very much in our thoughts as we cover this as journalists. This is the hour that we've set aside as our contribution to 702's look at 1 year of lockdown, 1 year of the harsh realities, both medical and economic, of COVID-19 in our country, but of course across the globe as well. We're focusing on the medical aspects of it. We're focusing on the challenges, but also on the many people who've risen to those challenges. Well, I did say this is a global problem, which of course you know very well. And to give us a sense of the wider world of COVID-19 and the way in which it's being tackled, we're joined now by Dr. John Blandford. He is with the U.S. Centers for Disease Control and Prevention. He's country director for South Africa and joins us, I think, on the line from Pretoria. Dr. Blandford, great to have you with us, and thanks so much for your time.
Good afternoon, John, and thanks to you and your listeners for allowing me to join today.
We're going to be ranging over a number of countries, but I want to start with you with the United States, because even people who have been dealing with their own difficulties, either in their own homes or their own countries, have followed with, I think, some degree of alarm the extent to which the United States has been hammered by COVID-19. I'm on your website, and caseload, which presumably will have changed within a few hours, is approaching 13 million, 29,708, 385. Terrifyingly so, almost 541,000 deaths. The graphs, though, suggest a tailing off, that peaks have been reached and there is some sort of flattening. What's your overall assessment? Because presumably coming out of winter will help.
So I'm glad you're up to date on your numbers, John. So you're right that the U.S. is approaching 30 million total cases, cumulative cases, COVID-19 so far. We are averaging today 55,000 cases per day. So we're on the downside of the third wave. But I should note that, that so far 550,000 Americans, just shy of 550,000 Americans have already died of COVID-19.
Right.
When President Biden took office just over 2 months ago, we were averaging 195,000 cases per day. So just for context, compared to the epidemic here in South Africa, we are coming out of the third wave. There is still need for robust public health interventions, even while we're trying to scale up the vaccination efforts that will be critical in order to get to the herd immunity through the right way, through vaccination.
Let's talk about vaccinations and the U.S.'s role within a larger global effort. Obviously, the U.S. As host to some of the countries coming up with the vaccines and with the massive purchasing power that Washington does wield, a concern that the U.S. may be trying to get more vaccines than it needs and in some way then impeding the opportunities of smaller countries with less muscle getting hold of vaccines. What's U.S. strategy in that regard? And, does a president feel obliged to serve his own people first, or is there a wider global view coming out of the White House?
Well, I think the answer to that question is yes to both.
Yes,
President Biden does see his primary responsibility to address the COVID epidemic in the United States, to protect the health and safety of Americans, to really understand and to address the profound impact that COVID-19 has had on American lives and health and on the economy and optimism about the future. So of course that is his first objective, as it would be with any national leader. That said, President Biden has also made very clear that he's committed to increasing the manufacturing capacity, the supply, the availability of vaccines globally, and seeing the U.S. as leading in those efforts. I think it's very important that the U.S. is now by far the largest contributor to COVAX, with a commitment of $4 billion so far.
Right.
And the Biden administration has placed out the challenge to other countries who are able to step up and contribute to the COVAX mechanism. And I think also then in terms of just expanding manufacturing capacity, it helps us globally then once that capacity is up and running.
I want to take you to an earlier part of your life, Dr. Blandford, because I've got your CV in front of me, and you were CDC country director in Vietnam, a country with a population of 98 million people. I'm looking at their COVID stats. 7-day average on the 20th of March was 3. Have they just got lucky? Because they're not the only country in the world with substantial populations living under conditions of in many cases, great closeness in the urban areas, and certainly no great luxury in terms of their economic status. Have they done things differently, or is there time still to come? And I don't wish this on anyone.
No, I think there's the CDC, other U.S. government agencies work closely with the government of Vietnam, as we are here in South Africa. I think the thing that was notable in Vietnam is they mobilized very early in the pandemic. They had seen the impact of SARS in the past and how it affected the health and the economy. They mobilized in the second, third week of January. We worked closely with them. This was basically, they succeeded. Again, this is a lower income country. They succeeded by perfectly implementing public health interventions. Mask wearing, they had a lockdown, but they went to universal mask usage. They went to social distancing and very good adherence by the population to those issues. I think those of us who come from Western nations, we tended to first see the masks as a way to protect ourselves. In Asian cultures, people are used to wearing masks as a courtesy when they're sick.
Yes.
You would put a mask on in these densely populated cities to protect others. And when you saw the mask wearing as an intervention for COVID-19, the uptake was quite good. So when I was in Vietnam, they twice eliminated COVID-19 completely from community transmission. So it was a willingness to take serious interventions early on that got them to the place they are.
And Dr. Blandford, bringing it back to our region and perhaps the continent as a whole, CDC has a presence on the African continent and tries in partnership with governments to keep up with what's happening. Your sense of the Southern African region, if you were to put us on green, orange or red in terms of alerts, Give us your sense of Southern Africa.
Well, I don't do color codes very well. I think what I will say is what I've been impressed by is the success in bringing down the epidemic curve when it rises. I think when you saw the lockdown that started on 28 December, when you looked at the data, almost 3 weeks later, the data started showing a drop in incident cases. A few weeks after that, yes, drop in hospitalizations. A few weeks after that, drop in deaths. So South Africa and other nations in the Southern African region can do those basic public health measures quite well, and can do them in a way that will bring down the epidemic. What happens, though, is we tend to relax once we start seeing the numbers come down, as we have in recent weeks. We start to relax, and the public health measures of work, the mask wearing, the social distancing, the avoidance of large gatherings tends to fall off, and we start to see resurgence in cases again. COVID-19 is always going to keep coming back as long as there's opportunity to find uninfected persons.
Thank you very much, Dr. John Blandford. He joined us from the U.S. Centers for Disease Control and Prevention. When we heard that there was another variant of COVID-19, I think many people's hearts sank. 501Y.V2 was in many ways a game changer for many of the strategies that we were going to adopt. It was more easily transmissible, and it raised questions, proved to be valid, about the efficacy of existing vaccines against it. But it also reflected some sterling work done by South African scientists. One of them is still a medical student at the University of KwaZulu-NATAL, Nelson Mandela School of Medicine, an aspiring virologist, and the role played by Sandile Cele was described by one person as the key person for this research. Sandile Cele joins us on Afternoon Drive. Sandile Cele, welcome to you, and thanks for your time on 702. It's great to have you with us.
Hi, John. Thank you very much for inviting me to come and talk to you guys.
So you were set a task as part of a team to try and find out more about this new variant, 501Y.V2. And then you made an important decision from the little bit I've read that whereas there was an attempt to study this using a monkey cell line, you figured out this wasn't working, and then you took a decisive step which has proved to be of critical importance. For people who are not scientists like yourself, what did you do and why?
Where do I start? So we started with this work of culturing the virus in the lab around June. So around June, we had all the viruses that did not have 501Y.V2 mutations. So it's just the earlier variants that we had circulating in South Africa.
Right.
So as part of my PhD project was to try culture this and then look at the genomic level of it to see what variants they are, if they have changed or if they have not changed. So I've been doing this for months now. So when the new variant, we read about the new variant, then we got this sample from CRISP, from Prof. Tulio.
Right.
The guys that are doing genomic surveillance. So they had access to this sample. Then they gave it to me to try and outgrow it so that we can study it further. And so for previous variants, I had been using a monkey cell line, like to outgrow or culture the earlier variants. When I tried culturing the new variant using the same old system that I had been using, it didn't grow. So we had to think now, what is it that we needed to do to grow this in the lab so that we could understand it. We'd imagine we have this 501Y.V2 variant, and we didn't know much about it. So the only way to study it is to have it in the lab. So we had to get on and then try and understand how to do it. So I had to figure out what else can be done. So we had a human cell line that we had in the lab. So we said, maybe let's switch to the human cell line and see how this is going to pan out. And indeed, after a couple of days, the virus was able to infect a human cell line and get more of it. And then we had to figure Okay, I'll let you.
Yeah. So, Sandila, I just wanted to jump in with a question, because the work you do is long and lonely, and I would think frustrating, but it must be even tougher when you're trying to understand something as dangerous and destructive as COVID-19. Did you feel that pressure as you were doing your work, or do you need to isolate yourself from that pressure and stick to the basics? How do you allow urgency to drive you but not confuse you?
The good thing about being here at Africa Health Research Institute is that we have a world-class laboratories. So, when you're working with a virus, you bring it in the lab, you get proper PPE and all that, and you work safe, and we get trained to work with such viruses. So there's a little chance that one can get infected in the lab. Actually, it's more probable to get the virus doing shopping in a mall rather than get it in here. So we are pretty safe. We know that we are working under conditions that we are not going to get exposed or something like that. And then also knowing that the work that you do, how important it is, it also inspires to even work harder. And then you have to be smart and try to think out of the box sometimes in order to get results.
Well, thank you very much, Sandile Cele, not just for the interview, but for your work. Congratulations on your contribution to this, and we'll keep up with great interest and follow your career as it unfolds. Thanks so much for your time on 702 Afternoon Drive.
702.
More than a radio station.
Let's walk the talk.